Welcome to Eye on America. I'm Michelle Miller. Today we examine some of the most pressing issues facing our healthcare systems. In Washington, we look into the growing push for hospital pricing transparency. Then in Massachusetts, we hear from medical workers who say private equity investors are affecting their ability to provide adequate patient care. But we begin with the ongoing campaign for HIV prevention and awareness. More than 30,000 Americans are diagnosed with the virus every year. CBS News medical contributor Dr. Celine Gounder meets with women working to make sure people have knowledge about and access to effective preventative medicine.
Step up.
You may have seen the commercials.
Descovy for PrEP is a once-daily prescription medicine that helps protect against HIV.
But weren't sure what PrEP was all about.
Would PrEP be a good option for me?
LaTanya Wilkins said she never knew PrEP was for people like her, even after she'd had an HIV scare.
I was dating a guy, and while we were dating, he found out that he was living with HIV.
And when you went to get tested, no one talked to you at the time about PrEP?
Nope. At the time, I hadn't even heard of PrEP, period.
Wilkins didn't start taking PrEP until years later.
I thought PrEP was for gay men or trans women. I didn't know that I could take PrEP.
Now she tries to educate others.
Make sure they have the resources to take with them. My conversation would be, girl, you heard about PrEP. And girl, you take some PrEP, that's the added peace of mind.
It's Truvada for PrEP.
The FDA approved PrEP medications in 2012. But more than a decade later, the CDC estimates only about a third of the 1.2 million Americans who could benefit from PrEP medications have been prescribed them. And a closer look reveals a stunning disparity. Among people considered at risk for HIV, 94% of white people are now on PrEP, but less than 13% of black people and less than 15% of women are getting PrEP.
I started Sister Love out of anger and frustration that nothing was happening.
Dazon Dixon Diallo founded a women's health advocacy group in Atlanta some 40 years ago because she saw that black women like Wilkins were being left behind in the fight against HIV.
I know I am HIV possible.
Messaging and advertising about PrEP has only recently been tailored and targeted to black women.
I'm a wife, a mom, I'm polyamorous, and I PrEP.
How many people we get tested for HIV?
Dixon Diallo and her team also stress the need to normalize conversations about sex and HIV and to be what she calls sex positive.
We want to acknowledge that people have sex and that just like anything else that we engage in, there are risks.
Science and education brought about a dramatic decline in the number of new HIV cases in the United States. But a case now before a federal appeals court could limit insurance coverage for PrEP. Some employers argue that they shouldn't have to pay for drugs that, quote, facilitate behaviors contrary to the employer's sincere religious beliefs.
I know it works because I was in a relationship with someone living with HIV and never contracted the virus.
For LaTanya Wilkins, tough choices may lie ahead. The cost of the PrEP medication, clinic visits, and lab tests averages more than $5,000 a year.
If my insurance provider decides, I don't want to cover this anymore, I really don't know what I would do because PrEP costs more than my rent right now. I have a lot of anxiety about that.
We turn now to Southern California, where a growing health and environmental crisis is affecting thousands of residents. Jonathan Vigliotti learns why the state's largest lake is drying up and leading to problems in the air.
4-year-old Damian Lopez has symptoms many who live near California's Salton Sea have.
His cough gets very wheezy. I try to control him.
Control often means visiting pediatric nurse Christina Galindo.
And then out, I can see up to 25 to 30 patients a day, and maybe half of those are dealing with respiratory issues.
A recent study found that more than 20% of the region's 178,000 people have asthma-like symptoms. This is nearly triple the national rate for asthma.
Why people who live close to the Salton Sea have such a high incidence of asthma?
Dr. David Lowe led a study at UC Riverside that identified that cause. The Salton Sea itself formed in the early 1900s after a dam break flooded the valley with Colorado River water. Today, its primary source is nearby farm runoff.
Fertilizer, heavy metals, like some arsenic, selenium.
For decades, this dangerous mix sat on the sea floor, but without replenishment from the Colorado, the Salton is rapidly receding, exposing a dry and toxic lakebed to the wind and also attracting a new industry looking to mine another chemical that lies below.
If California wants to electrify every single vehicle by 2035, they're going to need every piece of lithium they can get.
Frank Ruiz works for the California Audubon Society and sits on the commission overseeing the mining of lithium.
We don't completely understand the impact of the lithium industry. No industry is 100% free of environmental impacts.
Ruiz says lithium could be liquid gold for a region facing some of the highest poverty rates in the state. For now, it's unclear if lithium is a lifeline or a threat.
This is a toxic dust.
Do you worry that the Salton Sea and the surrounding communities could be sacrificed for the greater good?
I hope not. Taxes and revenues can potentially provide money to continue covering this toxic playa.
Michelle Lopez hopes her family is not left in the dust.
I'm concerned that one day they'll be like, you have to leave your house because you can't live in here anymore.
Coming up, many of us expect hospitals to be transparent about costs, but are they? That story's next. Welcome back. Hidden medical bills can often be an added burden to patients. A recent report from patient rights advocates finds some hospitals do not fully comply with government rules requiring price transparency. Anna Werner investigates the reasons behind surprise hospital bills.
When Pat Simmons and her husband retired over a decade ago, they left the U.S. to save money.
High costs of everything. We were finding taxes were going up.
It sounds like just the high prices of living here in the United States.
In the United States.
Just was too much.
It was too much.
They moved to Ecuador, where she says nearly everything is cheaper. But they come back regularly to visit family in Seattle, as she was doing last May when she suddenly started feeling ill.
On the flight from Quito, I got incredibly sick. I was throwing up. I was very lightheaded. I was going to faint.
After arriving in Seattle, she went to the emergency room here at St. Anne Hospital.
They did the CAT scan, and then they did the consult. And the doctor says, he gave me a sheet of paper that said, oh, you might have colitis.
Because she lives in Ecuador, Simmons doesn't have Medicare, but she had bought a travel insurance policy from company IM and the hospital sent the bill for the ER visit there. But some 3 months later, IM turned down her claim, saying despite her emergency that she had a pre-existing condition. And in September, the hospital bill came to her, over $16,000, with a CT scan priced at $11,000.
And I'm like, this can't be right. This cannot be right. It doesn't make any sense.
She wanted an explanation, but says she couldn't get answers from the hospital.
None. Never. Nope. And I sent several messages.
That's despite the fact that under a rule established by the federal government, hospital prices are supposed to be transparent. The rule requires hospitals to post pricing files with minimum and maximum prices charged for their services, as well as the cash price for patients who don't use insurance. Along with that, the rule says hospitals must display a consumer-friendly list of shoppable services or provide price estimates online. Simmons says she did a search online after she got the bill, typed in the CT scan on a price comparison website, and found the cash price for the same CT scan at that same hospital listed as much lower.
$3,500.
A cash price that was roughly a third of the $11,000 she was charged. When we went to the hospital's website ourselves and looked at the standard charge list, we got a price of over $9,000.
This isn't making sense to you, clearly.
No, none. I have this $16,000 bill that I'm not paying until I get answers.
A new report by PatientRightsAdvocate.org, or PRA, analyzed the websites of 2,000 U.S. hospitals and found only about 34% of them fully complied with every requirement of the rule.
It harms patients every single day to not know what they're going to pay in advance of their care.
Cynthia Fisher is the founder of PRA.
The truth is in the numbers. The prices are either there or they're not.
The American Hospital Association's Molly Smith says her trade association supports transparency.
Hospitals are committed to making sure that patients have all of the information that they need about their care, and that includes information about the price of the services that they are going to get.
She told us PRA's report is wrong.
Frankly, no matter how many times they say it, it's just not going to make it true.
Smith points to this 2022 assessment from the Centers for Medicare and Medicaid Services, looking at hospital compliance with the rule, that said 70% of hospitals fully met website criteria under the rule. But Fisher says,
we agree with the American Hospital Association that over 70% of the hospitals do have pricing files. It's just that most of them are incomplete. As long as hospitals and insurance companies hide their prices, they can charge whatever they want.
None of that helps Pat Simmons.
If they had told me when I went in there that it was going to cost $11,000 for a CAT scan and my bill would be $16,000, I would have gone home and taken my chances.
We turn now to another report from a hospital, this time featuring a promising partnership with a tech giant. NYU Langone Health and Meta have developed a new type of MRI that uses AI to dramatically reduce the time needed to complete scans. Anne-Marie Green tells us how the technology could expand accessibility and improve comfort for patients.
Dr. Michael Recht, chair of radiology at NYU Langone Health, has relied on traditional MRI scans for most of his career.
It's a great way of looking at the soft tissues of the body. The problem is that you have to acquire a lot of data to get the images, and that takes time.
But in 2018, NYU Langone Health partnered with Meta AI Research to develop Fast MRI. The technology uses artificial intelligence to significantly cut down on the time needed to scan without compromising image quality.
We're able to increase the speed of the scanning itself by a factor of 6. We put it through a neural network in order to reconstruct the image in a different way using AI to allow us to get image quality that is just as good or better than the fully sampled data.
Fast MRI speed brings comfort to patients like Jackie Gianconi, a Long Island resident who frequently undergoes scanning to monitor her cancer's remission.
I was frankly a little skeptical, but as time went on, I noticed it went from like 45 minutes to maybe 20 to 30 minutes. It was much shorter. The comfort level is much better. I just listen to music, daydream, go someplace else, and they're rolling me right out.
The technology also allows for Emma Lynn Giuffrida, NYU Langone's assistant director of MRI services, and her team to take in more patients.
Okay, you'll be all done in 3 minutes.
As we're acquiring pictures, we're getting the next patient set up. When they realize how fast it is, their nerves calm down. The patients are very happy to leave sometimes before their appointment time is supposed to even start.
Fast MRI is now standard for most patients at NYU Langone at no additional cost.
Because we have it on almost all of our machines, every patient who comes in, if we think it's appropriate, gets the Fast MRI.
In many instances, Fast MRI develops more detailed images than traditional MRI scans.
This is an image of the knee that was acquired with 8 times acceleration using conventional reconstruction. You can see how noisy this image is. This is exactly the same data as here, except it's using AI to reconstruct it rather than using our conventional technique. Look at the difference. We could never do that using conventional reconstruction.
Fast MRI success has Dr. Recht hopeful it will vastly improve accessibility to these scans across the world.
Both NYU Langone Health as well as Meta agreed that anything we did was open source. Essentially, every MR manufacturer has used a variation of the technique that we developed and incorporated it into their equipment, which means that everybody now has the possibility of really using Fast MRI.
Technological breakthroughs like fast MRI are pointing to the promising future of AI in medicine.
I really think that AI is going to transform what we do in the next several years. I think it's going to make us better. It's not going to replace physicians. It's not going to replace radiologists. It's really going to assist and augment us and really allow us to take better care of patients in really every aspect of medicine.
Okay, you're all done.
Ahead, a CBS News investigation into an alarming trend facing hospitals nationwide. This is Eye on America. We close our show with a look at the business operations of our healthcare systems. A CBS News investigation examines how private equity investors have impacted community hospital resources. Dr. John LaPook speaks with healthcare workers who say one company's efforts to squeeze profits left their hospital reeling.
Sanjita Rashid's smile could light up a room. That's what her husband Nabil Huq told us from his parents' home in Bangladesh.
The laugh was, contagious, and you could hear it from a different apartment even, but that's something I really liked about it.
With a baby girl on the way, Sanjita, a statistics professor, and Nabil, a postdoc student at Boston University, chose to deliver at Boston's St. Elizabeth's Medical Center. The hospital is one of dozens across the U.S. acquired over the past 15 years, with backing from private equity investors, by a company called Steward Healthcare.
Do you remember Sanjita's reaction when she first saw the baby?
She was crying. It was a beautiful moment, I wasn't expecting it to be this blissful.
That bliss was short-lived. Sanjita experienced cascading complications, first bleeding from her uterus, then discomfort in a different part of her body.
She felt pain and she couldn't sit.
And would it be in like the back flank, like where the ribs are, kind of?
Exactly.
Doctors sent Sanjita for an emergency CAT scan, then rushed her to the operating room.
And what did they find there?
That the liver was bleeding.
Doctors told Nabil they wanted to use what's called an embolization coil to stop the bleeding in Sanjita's liver. He says when St. Elizabeth's didn't have the coil, she was transferred to a second hospital.
And then an hour later, she had another cardiac arrest and they couldn't revive her. It was shocking, I said, well, what exactly happened?
What exactly happened, including why she died, is now the subject of a state investigation. St. Elizabeth's own medical staff filed this complaint with the state's health department, saying the manufacturer repossessed the coil weeks before because Steward hadn't paid its bills. In a lawsuit, the manufacturer alleged Steward owed nearly $2.5 million.
It's outrageous. It's unacceptable.
Why outrage?
Because the supplies weren't available that could have saved her life.
Nurse Kathy Reardon is an official with the union that represents healthcare workers at Steward's 9 Massachusetts hospitals.
They bought these hospitals to serve the underserved, and that's not happening.
Last year, our CBS News investigation found a trail of unpaid bills at Steward hospitals around the country, leading to a shortage of potentially life-saving supplies. At this now shuttered San Antonio hospital, nurse Jessica Carrasco told us there was a shortage of tubing for respiratory masks.
Coordinators were having to phone a friend to let us borrow, a cup of sugar.
In December, Steward announced it was closing one of its Massachusetts hospitals, setting off statewide fears. In a statement, the company blamed its financial woes on the pandemic and lower reimbursement rates from Medicare and Medicaid patients.
Do you buy that explanation?
I think that's hogwash.
Massachusetts Governor Maura Healey says Steward executives have driven the company deep into debt and enriched themselves at the public's expense.
The game was come to Massachusetts, make some investments, and then begin to suck out as much as you can in terms of profits.
Steward's initial investments included propping up the employee pension fund. But financial records show that since 2016, the company has sold off more than $1 billion of its hospital's real estate. And in early 2021, Steward's owners paid themselves millions in dividends.
They've taken money away from these assets, which are so important, hospitals that provide needed care, and they're using that money to line their own pockets. I'm disgusted. It's selfish. It's greed.
Healy told us she's placed state monitors inside Steward's hospitals to try to ensure patient safety.
And we have to do that because Steward has failed.
It's just still surreal that she's not here.
Nabil, who first learned the coil was repossessed from a Boston Globe reporter, says he's trying to focus on the small milestones in his daughter's life instead of wondering whether Sanjita would still be here if the couple didn't deliver at a Steward hospital.
Is that part of the problem? You'll never know. You'll never know whether having a coil would have saved her life or not.
Right. This is not how it should be.
For more stories like these and live coverage of breaking news 24/7, stream us right here on CBS News. I'm Michelle Miller. Thank you for watching Eye on America.